There are 5 situations that a physician should order an MRI of the lumbar spine in cases of people with low back pain. Today, I will show what are the signs and symptoms that should prompt a doctor to order an imaging study to clarify the proper diagnosis. So let's talk about when an MRI is useful in cases of back pain. Last week I released a video explaining that MRIs do not show the cause of pain. We cannot see pain in a spine MRI. The MRI is a picture of the anatomy of the spine. But if there are structural abnormalities, it does not mean they must be the cause of the pain. We know from scientific studies that people without pain also have many structural abnormalities found on MRIs. So there is an association, but not causation. But unfortunately, many doctors don't know this, and they think that ordering an MRI will pinpoint exactly where the pain is coming from. The majority of cases of chronic back pain are caused by things that do not show up on MRIs. So any abnormality, like a disc bulge, a disc prolapse, is just a coincidence and not the origin of the pain. Well, today I will talk about situations that should trigger the doctor to order an MRI or at least another imaging test like X-ray or a CT scan. There are very specific conditions that cause back pain or pain radiating to the arms or legs, and they are caused by serious structural problems in the spine. Therefore, there is a treatable cause. They are classified in 5 big groups. Please remember, this video is not intended as medical advice. If you think you have a condition causing your pain, please talk to your doctor to get a proper diagnosis. This video is for educational purposes only. And if there is an emergency, please call an ambulance or go to the nearest emergency department. The first indication to get an image study of the spine is a neurological problem. This could be a compression of a nerve root that exits the spine. It's called radiculopathy. In the neck, it's called cervical radiculopathy. And see my other video about this. In the lumbar spine, it's called lumbar radiculopathy or sciatica. See my other video about this. It could also be a case that the spinal canal is narrowed, either in the neck or the lumbar spine. This is called spinal stenosis. It is a serious problem because it compresses the spinal cord. In the neck, it's called cervical myelopathy. See my other video about this. And in the lumbar spine, it's called lumbar spinal stenosis, and see my other video about this. There is a serious condition called cauda equina. Fortunately, it is rare, that causes a compression of the nerves inside the lumbar spine, and if not promptly treated, it may lead to paralysis, and the person loses the control of their bladder, bowel, and in men, it leads to impotence. A doctor should suspect that the problem is neurological by asking questions and examining the patient. When there is a neurological problem, there will be other clues, like weakness of muscles, diminished reflexes, and abnormal sensory examination. The patient may also exhibit problems with their gait, balance, coordination, and control of the bladder and bowels. So, in the absence of other neurological signs, the mere presence of a back pain is not a sign of a neurological disorders. If you know someone who needs to see this video, use the share button here and send it to them right away. The second indication for an MRI in cases of back pain are inflammatory arthritis. Inflammatory arthritis are conditions that the body will create antibodies against its own organs. They are called autoimmune diseases. There are many different types of inflammatory arthritis. The most common are ankylosing spondylitis, rheumatoid arthritis, psoriatic arthritis, and gout. If the doctor suspects that the person has one of these types of inflammatory arthritis, they can order an X-ray of the spine or ultimately an MRI. But they will also order other tests like blood tests and sometimes X-rays of the hands and feet. The person with inflammatory arthritis will exhibit other symptoms, and this will give clues that the person has some inflammation going on. Watch my other video about ankylosing spondylitis and also an interview that I did with a rheumatologist. The third indication for an imaging study is if we suspect of a fracture. Fractures of the spine are rare, and the person might go to an emergency department if they fell from height or had a motor vehicle accident or any other kind of trauma to their spine. They will have other signs of fracture, like a bruise in the skin, redness, and if the fracture is compressing the spinal cord or the nerves, they will have paralysis or abnormal sensations. But there are cases of fractures without an injury, and these are commonly seen in people who have severe osteoporosis. Because the vertebral bones are weak, the person may have a fracture without a fall or an injury to the back. The pain starts abruptly and is very intense. Many people don't even know they have osteoporosis until they have their first fracture. People who use steroids for a prolonged period of time will develop osteoporosis as a side effect of this medication. So, when the person has a predisposition to osteoporosis, it is important to get an image study if they have a severe, abrupt, and acute back pain. In case of suspected fracture, an X-ray or CT scan might be better and faster than an MRI. The fourth indication for a spine MRI or CT scan is when there is suspected tumor. This is something that nobody wants to miss. Benign or malignant tumors can affect the bones and cause back pain. Benign tumors are tumors that are primarily from the spinal parts. They are not cancer in the sense that they will not kill the patient, but they may grow and occupy a space that is important. In the spine, the spaces are very small, and anything that occupies that space will cause some compression of important structures. In many cases, X-rays don't show benign tumors. Only a CT scan or MRI will show. Fortunately, they are very rare, but the doctor should suspect the person has a benign tumor if the pain is very localized and there are other signs and symptoms of a spinal cord or nerve compression. In cases of malignant tumors, there are usually metastases from other parts of the body. Colon cancer, lung cancer, breast, prostate, and kidneys are the most common types of cancers that send metastases to the spine. The doctor would suspect the person has a metastasis in the spine because there would be other symptoms of the cancer itself. Also because the tumor might be compressing other structures and leading to local symptoms of nerve compression. The person may also have an unexplained weight loss, anemia, lack of energy, and the pain is worse at night than during the day. Well, if you like this video so far, don't forget to subscribe to this channel. Here, I post videos about the causes and treatments for chronic pain. The fifth indication for an MRI or CT scan is if there is suspected infection in the spine. This is very rare, but there are situations that bacteria, fungus, parasites, or viruses will lodge in the discs. This is called discitis, or the bones, which is called osteomyelitis. These bacteria or fungus get there by the blood, especially in people who use needles to inject drugs and they don't sterilize them well, or by invasive medical procedures like spinal injections, nerve blocks, or even acupuncture needles. The doctor should suspect the person has an infection if they don't feel well, they don't have appetite, they have fever, and had some needle or procedure that could have introduced these germs. Nifty. This is the way I teach medical students and residents to remember these 5 problems in remembering Nifty. N for neurological, I for inflammatory, F for fracture, T for tumor, and I for infection. So if the doctor is thinking of one of these 5 conditions, they should order an MRI or CT scan and treat the problem. Now, if the doctor orders an MRI and does not find one of these 5 conditions, it was a useless MRI. Like in the previous video that I published last week, I explained that if we find abnormalities like disc prolapses, disc protrusions, and even disc herniations, but they don't correlate with the symptoms the patient has, then those abnormalities seen in the images are just a coincidence. We know this because there is a lot of research demonstrating that in thousands of people who do not have any back pain, the MRIs will show these results. And the older the person is, the more common it is to find this kind of things. But they're just like gray hair. They don't need treatment, no intervention. Just leave them alone. The doctor should explain to the patient, even before they order the MRI, that if they find these things, unless the patient has one of the 5 nifty conditions, nothing else will be done. The person should keep active and do not worry about the MRI findings. A lot of damage has been done because patients now believe they need to treat the MRI. They end up in unnecessary surgery, receive injections, nerve blocks, spend money that they don't have, and worse, they spend time doing things that they don't need, while they should spend their money and time on things that would help them. If you want to download my nifty handout, go to my website and download it here. It's free of charge. And thank you for watching. Goodbye.